All right, my beautiful nursing students, welcome to another video on Talk Teach Nurse. I am here today to discuss acid base imbalances. We're going to discuss the difference between the metabolic and the respiratory alkalosis and acidosis on both measures. Okay, so as you can see here, I made this beautiful chart. Um, I have here comparing metabolic acidosis and alkalosis to respiratory acidosis and alkalosis. As you can see here, I have the pH compared to the CO2, also compared to the HCO3. Um, what I want you to take home here is understanding one, first and foremost, your actual ranges. Your ranges is going to set the tone for exactly what you're looking for. When you see the pH, I want you to know that 7.35 to 7.45 is the range for pH. With CO2, I want you to look at 35 to 45 millimeters of mercury. With HCO3, also known as bicarb, I want you to notice that it is 21 through 28 milliequivalents per liter. Now, when you are thinking about metabolic acidosis, overall, one thing I want you to consider is the Rome method. I'm gonna hopefully be able to decrease this little bubble of me talking, but the Rome methods basically states that respiratory rates are opposite compared to the metabolic rate are equal. First off, when looking at the chart, what I mean by that is when you look at the metabolic acidosis in comparison to the metabolic acidosis, you can see here that the pH and the bicarb, this HCO3, are both arrows are facing down. So if you were doing these test questions, if you align the arrows correctly, it will give you an idea of what's metabolic and what's respiratory. So in this situation, you will be able to see, for example, metabolic acidosis, both of those arrows are facing down. When you look at metabolic alkalosis, both of those arrows are facing up. When you look at respiratory is opposite. So you're going to be able to make the chart. And once the chart is made, once you notice which way your arrows is going, and the arrows indicate here like PCO2 is increasing, while pH is decreasing for respiratory acidosis. So you see that the arrows are actually opposite. Same thing goes for the respiratory alkalosis. That will give you your first indication of whether that is metabolic or whether or not it's respiratory. Okay. Now, when you get into break it down and you see the difference between the two, an example of metabolic acidosis, I want you to think about diarrhea. I want you to think about renal failure. I also want you to think about DKA as well as dehydration, right? In that situation to where you have renal failure, you know you're going to basically struggle with offloading anything from your kidneys. Therefore, you're going to see a decrease in bicarb. Therefore, you're also going to see a decrease in the pH. Now, the reason that you know that it is alkalosis is because when you look at the pH scale, also on the page before, we know that the lower the number gets, the more acidic that it gets. So therefore, with a decreased pH, I know I am going towards acidity. So as you can see with metabolic acidosis, I have both arrows facing acidosis, both arrows are facing down, but I also note that I have a decrease in the pH. In these situations, when you think metabolic versus alkalosis, metabolic period, you're going to notice that the CO2 is remaining normal, right? The reason being is CO2 is gained or offloaded based off the respiratory system. We know that we inhale and exhale. When we inhale oxygen, we exhale CO2. So, therefore, in this situation, if I just told you it's related to kidney failure or DKA, some of those things, we know that it's going to be more so based off of what the kidneys are capable of doing. Now, once we get to respiratory alkalosis versus alkalosis and acidosis, we know that we have the opposite arrows as we mentioned before with the Rome method. In this case, when we take the first example, we notice that the respiratory alkalosis is normal. The HCO3 is normal. Reason being is because we stated that the HCO3 is based off of how much the kidneys is able to maintain or offload. In this situation, we're going to look at CO2 as well as the pH. Remember, we noted that alkalosis, the acidity part of it, we look at our pH and our pH is being decreased. The lower the pH goes, the more acidic the body becomes. As you can see here, the PCO2 is increased. An example of respiratory acidosis would be like respiratory depression or like a pneumothorax or the airway being obstructed. The reason being is respiratory depression. You think about it, it's basically kind of like holding your breath. If I tell you exhaling is releasing the CO2 and you hold your breath, you are going to increase the amount of CO2 that you have in your blood. So, therefore, with respiratory acidosis, you see the increase in the CO2 and a decrease in the pH. When you think about the respiratory alkalosis, you are thinking here, looking at somebody that's possibly hyperventilating, asphyxiation, asthma, pneumonia, aptitude sickness, is even hypoxia, right? The reason being, when you think about hyperventilating, that is someone hyperly ventilating, breathing very quickly. At that point, I am breathing off my CO2, exhaling it very, very quickly. Remember, that's why we have them breathe into the bag so they can breathe in the CO2 back whenever they are breathing it off and they're hyperventilating. At that point, you want to make sure that you look here and you see that the CO2 is being decreased, but my pH is increasing, because as the pH increases, a person is becoming more basic. So more alkaline, more alkalosis. You see it all the time with alkaline water being at 9.5 pH. So the increase in the pH is alkalosis. The decrease in the CO2 means that I am breathing out an excess of CO2 at that particular time. So, as you can see in these situations, these are when they are outliers. When they are within these normal ranges, we know that our acid base balance is normal. However, whenever these was my pH, my CO2, or my ACO3 are changing, we're looking for whether or not the patient is uncompensated or fully compensating based off those things. As I mentioned before, the lung is basically used to regulate carbic acid through respirations, and the kidneys is used to regulate bicarb, whether it's by retention or whether it's by excretion. um some of the things that we're going to look at next, we're going to consider just the acid base imbalance manifestations. When you're looking for metabolic acidosis, the vital signs is going to be bradycardia, weak pulses, hypertension, tachypnea. When you look at other things, you look for flaccid paralysis, confusion, hyperflexia, lethargic. Their skin will be warm, flush, and dry. Kussmaul's respirations. When you think about metabolic acidosis, you're thinking about the dizzy, the paresthesia, the hypertonic muscles, and decreased respirations. An example of metabolic alkalosis is an increase of antacids, possible TPN, blood transfusions, hypokalemia. I'm sorry, I think I did mention them earlier. Respiratory acidosis associated, you'll see symptoms of dizziness, palpitations, muscle twists, and convulsions. Respiratory alkalosis, you're going to see tachypnea, that anxiety, paresthesia, palpitations, as well as chest pain. So I hope that this information helped with building your confidence and breaking down respiratory versus metabolic acidosis or alkalosis. I hope you enjoyed this presentation. I want to say now, make sure you go ahead and subscribe. Make sure you are checking out the shorts that are created. You get a daily short and kind of to help you practice and prep for the NCLEX. Thank you for listening to Talk Teach Nurse, and I will see you next time. Make sure you subscribe, like, and comment. Let me know what videos you guys are looking for in the future, and I can get to working on those things. So thank you for watching.